Hi, everyone. Welcome to tonight's live Q&A presentation on telemedicine. We're going to wait a couple minutes as everyone logs in. I know a lot of you are very eager and interested in learning about our presentation tonight, and this has been a last minute presentation that we were able to put together for you with Galina, and we're very thankful for Galina to make herself available so quickly. So we still have some people coming in. Just gonna give it a couple more minutes so that everyone can log in and we can all start together. All right, wonderful. So welcome everyone. My name is Natalia Morrison and I am the Executive Assistant for FSOMA. This presentation has been organized and brought to you by FSOMA. We are a membership association for acupuncturists by acupuncturists, or acupuncture physicians, as we're known here in Florida. And I know that we're all going through a lot of shifting and adjusting as the world is going through all this. And we as an association feel very strongly about being here and supporting you the best way we can, and know that we have been working every single day, in contact every single day, trying to make sure that we have everything that you need and we can be a good resource for you. So on tonight's panelist, we have Ellen Teeter, our Executive Director for FSOMA. We have Jennifer Broadwell, our FSOMA Secretary, and also she is the chairperson for our advocacy group, and our advocacy committee, I should say, sorry. And we have David BIbbey, who is our Vice President for FSOMA and chairperson for legislative committee. Some housekeeping before we start. I see you guys found the chat box. Hi everyone, I'm so excited that you found it. So let's try it out. In the chat box, why don't you type in the city that you're in so we can have an idea where everyone is located. So just take a moment and type it in. Oh, awesome. Orlando, Jacksonville Beach, Gainesville, Miami, Denver, Colorado, hey, Miami Beach. So, oh, wow. Stanford, Plantation, Vero Beach, San Francisco, hey, hope you guys are doing okay. St. Cloud, Deerfield Beach, Boca Raton, Long Beach, New York, Austin, Texas, New Jersey, Punta Gorda, don't know what that is, Richmond, Virginia, Fort Myers, Bonita Springs, Oviedo, Christina in Miami, Sarasota, Michigan, Boston, Maryland, but also licensed in Florida. Wow, awesome. You guys are amazing. Thank you so much for being with us tonight. And some of you found our Q&A box. So if you look at the bottom of your screen next to the chat box, there's a Q&A. I'm going to be monitoring our Q&A. If you have a question, Okay, so we're gonna do, yeah, if you have a question, type it into the Q&A. And you can write, for example, if your question is specifically for Jen or Alan or Galina, you're gonna write that person's name and then your question next to it. And that's just gonna help me keep organized and make sure that we flow through our presentation tonight easily and effortlessly, the best way we can. And then comments and ideas that you have, then you can put those in the chat box, okay? All right, so we are ready to start. You guys can start typing in your questions. There are some questions that we're gonna start off with. The first one is, what is allowed in our scope in Florida via telemedicine? Herbs, acupressure, diet, exercise, instruction, for example, magnets, ear seeds. Can we recommend people using ear tags? Whoever wants to take that question.
I can take the question. Anything which is written in your state scope of practice, are you in Florida or in any other state where you are licensed and you have to be licensed in the state where the patient resides whom you are attending, you can act within the scope of practice of the state where your patient resides. If you see patient in state of Florida, even if you are located in Maryland, you look at the scope of practice of state of Florida and you act accordingly to that state. So essentially in Florida, thank you to FSOMA, everything except of needles. You cannot sell needles to the patient. You cannot send needles to the patient, but you can instruct them on acupressure, magnets, seeds, anything you pleased.
What about ear tags? Because those are tiny, tiny little subdermal needles.
Any type of needles, because according to federal law, actually, needles are reserved to licensed practitioner, and there is plenty of research supporting really high rate of infections with needle tag in the ear.
Okay, so your recommendation?
Non-invasive therapies.
Okay.
Needles are invasive.
Okay, so nothing invasive, nothing that would puncture the skin.
Absolutely.
All right, perfect.
Especially in time of the high infections.
Yes, that makes sense. Okay, next question we have. Do we need anything different to be specified in our waivers?
Yes, you usually do. In state of Florida, you do need to obtain the informed consent specific to telemedicine. Okay. In many other states as well. Please check your specific state. In my class, I do give resources how to access every single state acupuncture board and telemedicine board. So you have to obey to both.
Okay. And I know that we've talked about this one before. Does the initial interview have to be in person, face-to-face?
In state of Florida, law specifically says that initial visit can be established via telemedicine visit. In majority of other states, it does not say that directly. So accordingly, let's say in Cleveland Clinic, recommendation is primarily established patients. And if you look at billing codes for telemedicine, there is no specific code for new telemedicine visit. In the current, a little bit relaxed manner, MDs probably can see some of the patients which will be redirected to them accordingly to this each state epidemiologic situation, but in our case scenario, I would refrain. and only in Florida you are entitled to see initial patient via telemedicine visit.
Okay, perfect. And anything that needs to be done with malpractice insurance? I'm not, yeah. You need to adjust that?
Today, our acupuncture council, Marilyn Allen, sent out the email confirming that as long as we act within our state outlined scope of practice, we are covered for telemedicine.
Perfect. That's good to hear. And
Natalie, if you don't have that email, Ellen, if you don't have that email, I will forward it to you and it can be posted on the site.
Okay, and that's just with AAC. We don't know about any others.
I believe
at this moment, according to that email, which I received today answering on question, that you do not need to activate any telemedicine coverage. It's building.
I do not have confirmation on this, but I believe CMF also, as long as you practice within your scope. But I don't have confirmation on that yet. Next question.
I'm checking on that. So.
Okay. Next question. Any HIPAA specific requirements?
Yes. Before Corona, requirement was very, very strict. You must use HIPAA compliant special platforms. Like, for example, in case of acupuncturists, VC was pretty cost effective. For about $49 a month, they would supply for you a platform. Some other EHR, like Charm EHR, the one which you found, Natalie, I forgot the name, which you
Practice
found.
Better?
Yes, seems to supply telemedicine platforms as well.
Mm-hmm.
In Charm HR, it would cost about $50 a month for telemedicine and billing, because you can bill the patient before the visit. They can pay you right away, cash payment. On your platform, I don't know. And as well, I received the email from Charm EHR. That is the electronic medical records software which I use in my private practice, that they offer free telemedicine until July, which is great thing, some helpful. At this moment, as of March 17th, Trump administration announced that telemedicine law will be temporarily, and I want to highlight it again, temporarily relaxed, and we are allowed to see patient via FaceTime, Skype. For elderly patients who don't have smartphones, we even can use phone. Just be very careful. You cannot use any platforms which allow multiple public access, like Facebook, Twitter, absolutely not acceptable. That is a severe violation of HIPAA. And don't forget, after the Corona emergency goes away, all HIPAA law will be reinforced back.
Perfect, thank you. Again, I just want to remind all our viewers I'm seeing that some of you are writing your questions in the chat box. I need you to write them in the Q&A box. Okay, so if you've already written a question in the chat box, I need you to rewrite it in the Q&A section. All right, next question. Are acupuncturists considered to be essential practitioners in Florida? I think we need David for that.
The short answer is yes. I think the complicated part of that question is, are the medical services that we provide essential during a pandemic health crisis when non-emergency and non-urgent care that's elective has been suspended. So the position that FSOMA has at this point in time is that you have to draw the distinction. Yes, you qualify as an essential provider, just like if you were a dermatologist or a medical doctor, but services that you are providing that are non-urgent, they prohibit you from performing direct care in a live setting. So with that understanding, yes, you're an essential provider. Telemedicine is your instrument at this time to provide non-invasive care and consultation to your patients. I hope that's helpful.
Thank you. There's a question about a platform called doxy.me. Is it HIPAA compliant? I've seen that also. I think you're gonna have to look into go into doxy.me and look into and make sure that it's HIPAA compliant. The platforms that are HIPAA compliant will say they are HIPAA compliant. So the one that I use, which is different from Galina, is Practice Better, and it is HIPAA compliant. And I also have the option of connecting it or choosing to do Zoom. And there's like a $30 additional fee for that, because I know Zoom HIPAA compliant platform alone is a lot more than that. And someone just said, yes, doxy.me is HIPAA compliant. All right, next question.
Let me just go back to the question we had just 1 second. I would say the answer I provided with regard to essential providers, that's based on existing language in Florida statute. You know, there are no prohibitions and no exclusions to that right now. If you're licensed under 457, you belong to a group of providers that are identified as healthcare practitioners in Florida in Chapter 456, Section 1.4 under definitions. We're listed there along with every other type of healthcare provider you can imagine. So unless, and at some point in time, there may be a change to that, and that somebody may refine that list because they want to and find it necessary to separate out certain types of providers. There may be some more restrictive language that's produced going forward, but I wanted to answer the question that, you know, as of this evening and as of now, that essential provider status is active. It's subject to change. Again, the services they provide, you know, that's the matter of question as well.
Thank you for clearing that up, David. Next question. What are the specifics to providing herbs to patients, mailing, pickup, or other?
So what I use in my practice across the border, independent, it's Corona times or regular times. As in Cleveland Clinic, as in my private practice, I utilize custom compounding Crane Herb Pharmacy. The main reason is FDA compliant labeling, FDA compliant dispensing procedures, reflection of potential allergens on the label, professionally looking label, and I'm absolutely sure about quality of herbs which actually manufactured by KPC. Crane maintains records for 7 years of every single lot, every single prescription which I have written for every single patient. If anything ever happens for whichever reasons, I am fully legally protected from that standpoint of view. So, and Crane ships to the patient directly, all which I do without investing a single penny in my inventory. Yeah. They ship to patient and it arrives within 3 business days. The only time then it's maybe not necessarily applicable is in case of acute diseases, as it is now. But what I want to stress for you is our United States practical reality. We are not entitled to treat life-threatening diseases, unfortunately. You must refer life-threatening diseases to the hospital. And the moment patient fits corona testing criteria, you do need to refer them to Western provider. Please go on CDC website. It's very, very clearly outlines criteria which meets CDC testing. The moment the patient develops cough, especially deeper cough, start having fever, make sure that you refer them. So what I would do to stay legal and don't let God any fun dies, you know that it's not going to finish pretty. So our duty as traditional Chinese medicine practitioners at this point are prevention, prevention, and again, prevention. And I will email Ellen this evening an article which I wrote with evidence-based research studies that Yuping San is a wonderful prevention tool. And that's something which you can offer for every healthy patient, especially those who have propensity to catch common cold. Yes, he is really nothing better than Yuping San. That is what we are entitled to offer for the patients. That's what would be my take on our role. And if you absolutely must sell herbs from your...
Galina, your mic is not working.
Working now?
It sounds like something is rubbing on the mic.
Now it's better?
Nope.
Now it's better?
Yes.
All right, I cannot relax, have to sit like a lady. Yes. Absolutely must herbs, especially raw herbs from your own dispensary, which I will...
No, it went back. I'm sorry.
Let us stop at this moment on this question, and I will try to relog from my phone.
Okay.
Okay.
I can speak to a few things. There's also AccuMarket and Golden Needle will ship patent herbs to the patient. They don't do the customizing. And my feeling with dispensing from your office is that you do need to have a process that the patient pays over the phone and you leave the product outside the door for them. Or if they come in, you limit it to one person at a time and you have disinfectant procedures in place. Those are my thoughts from what I've been reading on that. Galina can say more if she needs to, but okay.
Yeah, let's just wait until Galina logs back on with a different machine. Let me review the, oh, there we go. Welcome back.
Can you hear me now?
Yes.
Okay. I will have to apologize sincerely that from my phone, I unfortunately will not see questions. So Natalie, I would appreciate a lot if you would read them. But to reiterate on Ellen's answer, yes, that's exactly correct. You will need to evaluate patient via HIPAA compliant technology, be it VC, be it Zoom, or even via the phone, FaceTime, Skype at this moment, compound the formula, gather the payment via the phone, and put the herbs outside of the door. Just confirm them they're coming for pickup. That's what would be a proper social distancing.
Next question, and this one is a really good one. How will I check pulse via telemedicine?
So Natalie is smiling because she attended my telemedicine class at last Florida State conference that I taught telemedicine, and I was very specific in how to gather patient pulse. If you go on my website, asiantherapist.org, you can look at page books. I actually have specifically invented the way to interpret mobile EKG. And you see commercials on TV now all the time about mobile EKG device. So at current plan, if Ellen has not changed the plans yet, it's projected that I will be teaching mobile TCM pulse interpretation this coming summer at Florida State Association conference. But even if it's too difficult for you right now, simple sign, what you can collect right now, you can ask patient, look at their wearable technology. Many of them have at least pulse rate. That's already something which you can collect. And normal pulse rate is between 60 and 80 beats per minute. Anything which is below 60 is slow. Anything below 80 is fast.
Anything above 80.
Yes, anything above 80 is fast. Anything above 110 is racing. Fairly simple.
Perfect. Thank you.
And actually, in the telemedicine class, I have explained how to post your patient pulse and how to collect patient tongue, because don't forget, even if patient sends for you picture of the tongue, it will differ tremendously depending on the lighting that a patient takes. So in my class, you can print the handout, which you can email for the patients, for they could put a color reference strip right beside their tongue and email it to you, or deliver via HIPAA compliant website, for you could evaluate how really their tongue looks.
I recommend everyone to take Galina's telemedicine class. When she did it for our FSOMA conference, Jen and I took it, and I was just like completely amazed. It was revolutionary for me. So I encourage you all to take it. Next question. Does this also include new patients we have never seen before? Cameron, I need you to be, or everyone, I need you to be more specific, because we have right now 30 questions on the queue. And since we're taking our time to make sure that every question is answered correctly, please make sure you detail your questions so that we know how to appropriately answer it. Because I don't know, does this also include new patients we have never seen? To what topic that one is relevant to? Next question. What is actually practical that patients will feel is effective and worth paying for?
On this question, I probably would say that this is your discretion at the current moment. You need to evaluate how tech-savvy patient is, because no matter what I say, if my 80 years old patient does not know how to do the computer and all what they have is a flip phone, the only choice what I have is a flip phone.
Right. So how are they going to pay you with a flip phone?
Then they're going to call you and you will collect their credit card over the phone.
Okay. Perfect. Thank you.
You know what, guys, I was just going to say quickly, you know, it's a time for some creativity and a little bit of self-examination of, you know, what your skill set as a practitioner is, you know, and marry that with the needs of your patient. It might be limited to consultation for herbs, redoing those scripts, modifying those scripts if necessary, but you can sort of slide away from some of the straightforward things that you might otherwise think of and consider how consultation for anxiety, how a breathing class might be helpful, and do some one-on-one instruction for your patients in this way. It's, you know, valuable time that you can bill for, and it's valuable information that you can share with your patients. So it's really an opportunity to look deeply into our scope of practice and understand where your strengths are. And you can both, you know, communicate through your mailing list with your patients and start scheduling events, things that you want them to participate in if they want to, or doing one-on-one consultations for their individual needs. But we'll probably have a separate class just on this question of creatively using the skills and knowledge that we have as practitioners and sharing those with your patients proactively.
And remember, even if you are billing patient insurance for telemedicine visits, it's considered to be a consult codes. They are time-based and they are not limited. Are you prescribing any herbs or not? It's a consult code. Even if all what you're doing is calming the anxiety of the patient. And believe me, right now, it's maybe one of the most valuable options which you can offer for your patients because they cannot reach their medical doctor right now. And medical doctor not going to spend with them 10 minutes just calming their anxiety down. You are here for them for that.
Right. Thank you. Thank you, David. Next question. How do we address the pulse and tongue parts of the diagnosis with telemedicine? Casey and Galina just answered that. And for more detail and learning the technique and how to do that, I recommend you take her telemedicine class. It's more in depth. Next question. But the email from AAC also said that you must specifically ask them, I'm assuming the patients, to ask them to activate it. That it does not have an additional fee. So I believe here they're saying that AAC says that you have to specifically contact them to activate this part, even if there's no additional fee.
Right. I can confirm that I had that information from AAC today as well. No additional premiums involved, but you should contact them to let them know that you're providing telemedicine services to your patients.
Thank you, David. Galina, if you already have a signed consent to treat with an existing client, do you need another one for telemedicine?
According to Florida law, yes, you do. You need to include at least a phrase that they agree to the telemedicine appointment. It doesn't have to be signed in person. At the current time, you even can include just a phrase in your notes that due to coronavirus, no face-to-face personal contact, but patient confirmed over the phone that they agree to services of telemedicine provided to them or something in these realms. It doesn't have to be very, very formal.
Okay, that's enough during this time, but ideally, we do want them to sign a specific telemedicine waiver.
Absolutely. Ideally, it should be signed. And if you have telemedicine platform, or if you use something like Charm EHR or any other EHR systems, would have patient portal for my patients, because I'm licensed in Florida and in Ohio. And in Florida, I can see patients for initial appointment via telemedicine. I just send them electronic consent, and they sign it electronically just with the finger on their phone.
Huh, really cool.
Absolutely. Simple.
Yeah.
Technology sometimes is absolutely cool thing.
Yeah, it is. All right, next question. Can APs use Ching Fei Phi Dutong for COVID-19 patients in Florida?
I think you answered that already. You said, according to federal law, we're not allowed to treat life-threatening conditions, and if they've been diagnosed with COVID-19, it's life-threatening condition. It's a federal statute.
You can treat them as long as they have been tested. You need to refer them for testing immediately
Okay.
if they fill the criteria that they need to be tested. Yes, don't try to hold them from visiting MD. But if they are in mild stage, at initial stage, they will not hospitalize them. Or not necessarily. It all depends on pre-existing conditions. If patient is in danger to develop severe complications, of course they will hospitalize them. And that's then nobody will let us in the hospital to treat the patient. But if they are at home, there is absolutely nothing wrong with treating them. We just need to instruct the patient that if fever continues to be there, if condition worsens, they need absolutely to go. And again, act within the FDA rules. Yes, Ma Huang, to the best of my knowledge, still is on the ban. If your herbal formulas contain Ma Huang, be aware about it and comply with FDA rules. So there is quite a few of those specifics, and definitely make sure that you don't see corona patients live in person in your offices. So we don't have to refuse the care. We just need to exercise the common sense and make sure that we act in the best benefit of the patient.
Oh, thank you for that clarification.
And I think it's important also to be cognizant of the languaging that we're using. We do not treat COVID-19, we treat a pattern, and we need to be careful as to what we're actually saying that a formula is for and what we actually say that we're treating. We need to make certain we're not making medical claims here and that we're treating within our scope. So that's a differential diagnosis in the pattern that we treat.
Absolutely. Thank you, Jennifer, for these remarks. We always treat in pattern and we always treat symptom. Yes, we treat in cough, we treat in fever. And we never, ever, under any circumstances, can tell anyone that they have COVID-19 until they are tested and test confirmed by their MD.
Right, and we don't say we cure.
Never. We have structure and function claims.
Absolutely. And actually, guys, beta version of ICD-11 is out. You can just Google beta version of ICD-11 chapter 26. This is our diagnostic codes, which will be incorporated in 2023. In my class, I have a link, but you can just simply Google them and it will pop out. And use your pattern differentiating diagnosis from ICD-11. It will add credibility to your statements.
Wonderful, thank you. So sorry, go ahead, Ellen.
I missed the page number on that page, on the ICD-11, page 27?
Chapter 26.
Oh, okay.
Chapter 26 for traditional uses. I'll send a link to you, Ellen, and you can post it on the website. I'll send that now.
Okay, so I have several questions on the platforms. There is the one that Galina uses, which is Charm EHR. So I believe, Galina, correct me if I'm wrong, it's CHARM EHR.
Give me just a second. Yeah, spelling unfortunately is not my forte. It's CHARMEHR.
Okay.
Charm, very charming. Or think about website that this is a Prince Charming.
Yeah, I'm gonna write that in the comment section for everyone. And that one is the one you said is offering telemedicine free. Oh, perfect. Until July?
Yep, till July 2020. But it's only telehealth. It's not the platform itself. But platform itself, at least when I subscribed, was free if you see less than 50 patients a month. After then you see more than 50 patients a month, each patient record costs 50 cents, which is excellent option, especially for starting practitioners. And it's actually, they bill you on the number of charts which you close.
Perfect, thank you. And there are multiple aspects. There are multiple platforms. I personally use Better Practice. If that one is something that you're interested in, I can send you a link to that one. There is Simple Practice, yes. Jane, I believe, just rolled out, they just rolled out their telemedicine. Unified Practice just rolled out also their telemedicine platform. I'm not sure if OptiMantra did as well. I'm assuming they might soon. So there's a bunch of different platforms. If you already have an EHR program, contact them directly and see where they're at with that.
Yeah, because before the FSOMA, last year I spoke with Unified Practice, since that one was very, very conducive and specifically built for acupuncturists. And the answer what I got, practitioners not interested. It's not in our plans to incorporate telemedicine platform anytime soon. We're not interested. But now everyone and their mama is interested in offer telemedicine platform. So, and if they said no to you today, it's maybe yes tomorrow. The same with insurance reimbursement. If you called for this patient today asking will insurance pay for telemedicine, it's maybe no. You call tomorrow and it's maybe yes.
Yeah, especially now how things are shifting so quickly.
Yep.
Next question. Which was used in China for treatment COVID-19? David, I'm sorry, I think your question is a bit vague. So if you can rewrite it with a little bit more clarity, then we can go ahead and answer that for you.
Are we planning another education event this week with some more provider protocol and information on treating symptoms and aftercare?
Not for this week. I might have that set up for next Monday.
Okay,
but
so those questions we can kind of steer with that in mind. We want to provide, practical practitioner advice, but so if it would be easier if we stuck to the particulars on how to practically perform telemedicine.
Mm-hmm. Yeah, FSOMA is working, and we have contact with an acupuncturist that was recently in China, and we're working on preventative protocols and treatments and post-recovery care. So we're working on that, and we'll have that for you guys soon.
And how I said, I wrote an article on evidence-based treatment for coronaviruses based on past experiences as well and current strategies. I will forward it in written to Ellen. It also will be a resource for you to look up for yourself.
Yes, thank you so much. Right, next question. So are stainless steel balls okay? I think the answer to that is yes, as long as nothing punctures the skin. Is that correct, Galina?
Correct. You don't want to open doors for any infections. That's the entire premise of self-home care for the patient.
Thank you. Next question. MIEC cover telemedicine? Question mark. I don't know what MIEC is.
Neither do I.
No, okay. So Misha, if you are listening to me here, be a little bit more specific because I have no idea what those letters mean.
Looks like it might be another malpractice company. So malpractice insurance, and I think that we don't know the answer to that at this moment. We are taking down a list of these questions that are coming in. And so anything we don't have the answer to at this time, we'll go back through review, and then we'll be posting those answers on the FSOMA website, as well as the FSOMA Facebook page, along with this recording.
And that's also a good question. I mean, you might just contact your malpractice carrier directly, and they can answer it for you in, short order.
Yeah.
Okay. Actually, Maury West says that, yes, it is a malpractice company and they are allowing telemedicine. But if you do have that company, call them directly. Okay. But FaceTime, okay, even though Facebook video is not? For telemedicine?
FaceTime, as long as it's one-on-one with the patient, and the proper verbiage, what you put in your notes, that this is face-to-face time with the patient, and you need to record how many minutes, because when you bill the insurance, your Cpt codes are time-based. So, and like in normal times, in your acupuncture notes, you write as many minutes were spent face-to-face with the patient. But you make sure that in your notes, you also put that this was virtual or telemedicine or telehealth. Any of three is a synonym appropriate to be reflected in the notes.
Okay, thank you. Another question. This is someone trying to clear something up. Sorry, I couldn't understand what forms she was talking about. It sounded like she said blood forms. And I don't think that's correct.
Sounds like they're asking about platforms.
Platforms, okay.
Yeah. You anyway still have to conduct proper documentation exactly like you would do for your in-office visit. So the only thing which changes for you as a provider, you speaking with your patient face-to-face over a FaceTime or Skype or any other telemedicine HIPAA compliant platform, but your notes still the same. You're still reflecting exactly the same information. And you are reflecting that it was virtual visit with the patient, you gathered the symptoms, you gathered objective science, you wrote such and such prescription, you gave such and such recommendation, and you sign in your note, finishing with the phrase, 10 minutes, 15 minutes, 20 minutes, whatever minutes you spent face to face with the patient. That's just a standard note keeping.
Thank you. Yes, and I know that we've talked about appropriate note keeping, and we'll probably do a video on that as well for you guys. Galina, please repeat the names of the companies about the HIPAA compliance telemedicine component. Charm ER is the one that Galina uses.
You can use Charm HR, but like any electronic healthcare record systems, any of them requires a little time and a little adaptation to learn how to use. If you are in the crunch and have a lot of patients to attend, and it's very difficult to switch, and it unfortunately does require the learning curve from the patient side as well, you can utilize a simpler platforms. Like one of them is VC, V like in Victor, S like in Sam, EE. This is specifically telemedicine platform. It's not electronic healthcare records. Then you're using VC, you may have a simple notes to write in that platform, or you can continue with your handwritten records, what you have been doing all along. You're not obligated right now in the current time crunch to switch to completely new electronic platform, which requires time. Use simple things. And probably something like FaceTime or Skype at this moment might be a little bit easier if your patients are panicking. But don't forget to inform them that when things settle, they can continue to use convenience of virtual visits. My patients love it because I see a lot of snowbirds who are for summertime in Ohio and for wintertime in Florida, and they are in love with my virtual appointments. But it's, yes, it takes time for them to learn a little bit as well.
We're all learning.
Yep, we're all in the same boat.
Another question. Can we get a list of acceptable platforms to use? So I will do my best to put that together with Ellen, and we will put that up on the FSOMA website as to the acceptable platforms that you can use currently during the corona crisis. But some of those are not HIPAA compliant. So for example, FaceTime is not HIPAA compliant. It is only, like Galina has said, during this crisis. Once we're clear of the crisis, it is not acceptable. You cannot continue using FaceTime, and you're going to have to use a HIPAA compliant platform.
And now, especially if then our acupuncture patient load have subsided, use the time to actually subscribe to electronic healthcare record systems and learn them. In many of them, you will need to write your own standard operating procedures, protocols. You will need to establish the templates and all of that. Try to use time wisely. If nothing changes, and you know, it all depends how this corona epidemic unwinds. But so far, we with FSOMA have planned that on May 16th, I should be teaching ICD-11 terminology, and during that class, I will share the standard templates, which will reflect changes for our EM billing codes, which will be effective 2021. It's completely changes. We don't have to evaluate all of the systems any longer. It will be very problem-focused approach. So your templates will need to change. So if everything goes fine, In that class, I will provide for you a standard template, which is approved by our, Cleveland Clinic review board, internal audit board, since we do bill Medicaid. So we have to comply to government requirements. But until then, try to learn how to operate with electronic healthcare systems. We anyway will need to switch it. And the moment ICD-11 is here, it's probably will be mandated.
Yeah. Silver lining. Learn it now.
Yep.
How does the law determine what is not urgent? I think this is a David question.
My suggestion is that you take a very plain language interpretation of what the governor's executive order states. It identifies both types of practitioners and gives examples of types of procedures that are non-urgent. And so what you want to ask yourself is the care that I'm providing emergency care? Is it urgent care? And it's not necessarily, in my mind, a function of time. Urgent, like, in a hurry, like somebody needs to be seen right away. It's the magnitude or the complexity of the condition that you're dealing with. And then look at that and compare that to your knowledge, skills, and abilities and your scope of practice. So there's not a list where you can refer to saying this is or this is not urgent. And the standard that will be applied to your decision-making on that will be probably your peers, and then regulators and other people who maybe come from higher echelons of care, surgeons, emergency room personnel, and people like that who would be evaluating whether or not something is urgent or emergency. So I would say take a very literal approach to that. It's based on complexity and the nature of the concern. Maybe Jennifer has a more clinical response to that.
Well, I will say that in the hospitals, we were shut down. In my hospital, we were shut down 2 weeks ago for only anything that was non-essential medical procedures. And so I think that one of the things that I use in my clinic is really the idea of, if I needed to defend this down the road, does this make sense? Can I explain why this was necessary right now? Was this a treatment that could prevent a patient from winding up in the ER? If so, then that's one explanation. If this is simply a wellness visit, I don't think that qualifies. But I really do think this is going to be, unfortunately at this point, a real personal decision. It is difficult to find any guidelines on this because there are so many conflicting information that we're getting. There's so much conflicting information from the federal to the state to the county level. So we're doing everything we can to get an across-the-board answer. At this point, I would urge you to really consider, how does this make sense if you needed to explain this down the road?
Same here, though Cleveland Clinic that I work is in Ohio, but we do not consider to be essential service. The definition of the hospital for essential service is life-threatening condition. And that's what all of the resources of personal protective devices, disinfection, diverted to. So all acupuncture visits have been canceled a week ago. As of tomorrow, we all acupuncturists are on work from home order. I still see my virtual patients though from home. So my colleagues right now are very stressed that if situation continues, they may be let go on leave of absence with no pay or who knows what. But at least in my case scenario, my virtual visits save me a spot.
I do know some people that have worked in the medical system that say urgent and emergency have very definite meanings for them. And basically it means, is this person, like Jennifer said, going to end up in the ER or worse if they don't receive this treatment? So for some parts of the society, that's what it means. I know sometimes it's like, I slipped and fell and twisted my knee. I urgently need you to treat it. And that, you know, you could make a case for that, but you know, it's difficult. The governor has not wanted to come out and be clear. Has let this be kind of a, you know, up to the profession to decide how to define this.
I think you guys, let me add just another quick thought on that. It's, you know, depends on what the condition is that somebody presents with. Like Ellen's example is a good one in terms of the twisted knee. You might consider that to be urgent, and your patient may consider you the first line of care for a situation like that. It's just unique to the patient and practitioner relationship. Their first instinct might be to go to the emergency room instead. But if their instinct is to come to see you, then a cascade of other responsibilities kick in terms of how prepared are you to use personal protective equipment and disinfect your office to deal with that encounter. And if that patient encounter can't be managed in a way that's compliant with CDC and Department of Health requirements at this time, then you have to, in your best judgment, refer them. Even if they called and said, I really, really, really want to see you. And it's not a question of whether or not you can because you're an essential provider, or that you should because you think it's an urgent medical condition. It's whether or not you can manage them safely in your office. And all of this will be scrutinized carefully for patients continuing to treat without additional guidance from the governor, the Surgeon General, or the Board of Acupuncture here in Florida. So it's a complex question to answer. There's several moving parts to that. But generally speaking, I have a hard time determining in my own practice, you know, any condition that somebody would call me on that was urgent enough and emergency enough that I wouldn't just refer them to a higher echelon of care, emergency room, urgent care. Okay?
Thank you for clearing that up. I know that that's something that we're all struggling with, and we're all having to make moral and ethical decisions that we haven't had to do before. So thank you.
So if I may, let me add a weight to your medical decision. You all can go on the website. It's called worldometers.info. WORLDOMET, like in Tom, ERS.info/coronavirus. And you will see data live. As of a couple hours ago, United States had 43,469 cases. Just from 2 hours ago, update was almost 10,000 new cases. We have 545 patients dead. In last 2 hours, it was new 132 deaths. Total recovered so far, we have only 295 patients. So we still have 42,629 active cases. Out of them, serious and critical are 1,040 patients. Yes, that's exactly the website which I'm talking about. So numbers are really high. Please use your best judgment. Which predictions say that biggest influx of the patients actually is projected for mid-May. We will see more cases, okay? So it is pretty scary. So consider how quickly it is growing. Look on that website. It updates very quickly, very regularly.
Yeah, and down here at the bottom, you have it by country. So here we are, the US. So far, it has 139 new deaths, total of 552.
Yep. So.
All right, and I'm gonna share the link.
Yeah, it's literally what I read for you. A few minutes ago, I opened that website. Actually, I opened that website at the beginning of our telesession. It was 132 deaths. Now it's 139 new deaths. So we added 7 deaths in less than an hour. So exercise your best judgment. Do you really want to see patients?
All right. Next question. Can we treat patients in a live setting?
I believe that David just answered to it.
I just want to piggyback on what Galina's saying. Is saying, of course we want to see patients. I mean, this is the nature of healthcare providers, and we want to be part of the solution. It's just unfortunate that the reality of the infection rate and the inability for acupuncturists who do not have first-tier quality personal protection equipment and capacity to disinfect their office, they should not be coming in personal contact with anybody at this point in time, because we have to assume that the population is largely either infected or carriers. And if not now, certainly over the next period of weeks. And from an ethical standpoint and from any other perspective, socially and otherwise, we have to just assume that if you're not in a position to protect yourself, your patients, your community, your staff, then engaging in in-person patient care is reckless at this point. And there's only so many ways that we can convey that. So using telemedicine, as we're describing this evening, gives us an opportunity to remain engaged with our patients' continuity of care. We can engage with new patients who are reaching out to us here in Florida anyway. And this is the strategy for our provider type, given the knowledge, skills, ability, training, licensing, scope of practice that we have, to use that to the full extent that's both ethical and responsible at this period in time. We'll continue to work hard to advocate for the profession and find new ways for us to treat and engage and work with patient care and other practitioners. But at this time, we have to respect what the natural boundary is of what we do safely. Okay, I'll let Galina take it back over.
And please remember, social distancing order is federal and it remains, yes? It's very hard to provide acupuncture treatment being 6 feet away from the patient. In telemedicine, we definitely can do that. Even if you don't practice any really serious treatments or anything like that, right now it's not the focus for us. Right now, our focus is try to help as many patients as possible remain healthy and do not succumb to corona. That's then strengthening the immunity is a first priority for us.
Yes, thank you. So this is also, I know we've talked about this question. This is someone that has over 300 individual single granule herbs at home or in their clinic, I mean, and they don't do drop shipping. So in your opinion, what would be the best way to provide these mixed formulas for patients? So I think we talked about curbside pickup, where they pay you electronically, and you maintain that distance with them. Does telemedicine only apply to certain diagnosis codes?
To the best of my knowledge, this is a procedural code if you bill in the patient. You bill in for evaluation and consult. And unfortunately, like with many other issues with acupuncture billing, it depends. Will insurance of this particular patient pay for consult codes? It might be based on diagnosis, it might be not. Insurance may pay for diagnostic codes or may not. At this point, it's daily checkup. And how I said, even if for this particular patient, yesterday you called to insurance and they answered they will not pay for telemedicine, you can call today or tomorrow and answer maybe yes. Keep trying.
Okay, thank you. What about once they have been referred to Western medicine, can we treat cough, fever, other symptoms in conjunction with their observation treatment? Most people do not get tested here. Yes, I believe Jen and David and Galina answered that question earlier. Unless you
Not
have...
every single patient gets tested. Go on CDC website, look at the criteria because criteria change as well. The CDC website is your best resource. Every day they change the criteria for the patients who get tested. As of today, they did not test patients who are asymptomatic and don't have any serious pre-existing medical conditions. Tomorrow, it may change. CDC website.
Thank you. If we refer a patient to the ER or hospital and they are then released back home without being tested, are we then allowed to recommend herbal and nutraceuticals? Do we need any documentation about them being released? I would say yes to that.
I would say yes. Protect your practice, protect your license. Make sure that if you don't have a physical copies of their visit, you at least document in your notes, according to the patient, on such and such date, they went to such and such hospital, or they went to such and such MD, were tested for coronavirus, test results were negative.
Okay,
That will be your legal protection.
So this is a question that we've been talking about legislatively, or with what happened on Friday with the governor. And I do want to read it, but I think that what I would like to do, if it's okay with FSOMA, is do another news update for you guys where we can tackle these questions. So the question is, chiropractors are still open. Why can't we see patients? So I want tonight to be specifically for telemedicine and a good resource for you. This is a great question, and this is a question that many people are thinking of. So let's leave that for another live Q&A where we could specifically target those questions. But please, thank you, and we will keep it in mind. Next question, why is phone not HIPAA compliant? No one else can have access. It is about encryption. It is technology encryption. HIPAA means that it is encrypted and protected. Your camera phone is not. It can be hacked.
Another thing about HIPAA compliance. As of billing and Medicare, Medicaid regulations concern, before Corona, you could bill only for encounter face-to-face. You physically had to see patient. And all phone communication with the patient was non-billable service. It was simple follow-up. You could not necessarily gather the symptoms and prescribe on the base of the phone encounter. Now, because internet is so overburdened, and unfortunately, all technology crashes so badly, sometimes we just don't have any other way to attend the patient and to visit and to finish the visit. It's common for the last week for me to start HIPAA compliant American Well platform visit with the patient in Cleveland Clinic and have a crash in the middle of the visit and continue with the phone. Same in my private practice, unfortunately, it does happen. They're working on it, they are improving it, but it's why phone was approved and billable encounter right now, but it will go away.
So Galina, when you're doing your notes, would you say telemedicine consultation performed via FaceTime, telemedicine performed via CharmER or Zoom or phone call?
At this moment, at least I have not received any mandates from anywhere on that subject because clinic doesn't use FaceTime. We actually opened our own e-visit through MyChart at the clinic. At home, I do note there it is, and usually if I use CharmER, I just note CharmER platform virtual visit. If it's phone, you do need to put that this is phone.
Okay.
Just to make sure that everything is corrected, and you can actually put in your notes just for legal reasoning that patient was informed that temporarily during COVID-19, phone is considered a HIPAA compliant way of communication.
Thank you. Any recommendations on how to communicate to patients that we are providing telemedicine and what we can provide for them in the meantime? Asking for some advice on successful telemedicine visits.
First of all, it's very difficult to communicate with the patients which are in pain and may not necessarily understand that you are the same medical provider like their doctor. Try to select your verbiage. We are instructed to start our conversation that for your safety, in compliance with government orders, I would love to offer for you telemedicine visit. It's very similar like in person. You still will see me on your phone. And everything else we talk is exactly as it is in the office. The moment patients hear that it is for their safety, they usually are pretty polite to that. And I always reiterate for them that they will save a lot on gas. It's really convenient. Just try it, you will like it.
Thank you. Okay, we still have 30 questions on the queue. When it comes to telemedicine, do we still need to see every first patient face to face? So we already answered that one. It does not have to be in physical person, in person, but it can be initial consultation via the camera. This is a billing question. Can you bill anxiety and supporting immune system? We were hoping to, we are working with one of our billing business members for FSOMA, and we will have a webinar for you as soon as we can. We're still doing research on billing and all this stuff. So hopefully soon, stay tuned for that. We will have an educational webinar for you. Can you just hit activate on the email as far as I saw? I think this is regarding the AAC. So if you have AAC, just check your email or give them a call. Thank you for this excellent information. How do we deal with out-of-state patients as state licensure requirements for each state is different for licensure? So if you're Florida licensed, you can only see Florida residents.
Otherwise, go on my website, check state by state. In the class, it gives for you a link. You will need to obey to both. You will need to obey a law governing telemedicine, and you will need to obey a law covering East Asian medicine or acupuncturist. Different states will have very different laws. Some of the states have very explicit scope of practice. Some of the states don't mention anything at all about herbs, for example, only acupuncture itself, but you still will need to obey the telemedicine law.
I think the other thing we want to be mindful is that the Surgeon General did sign an order last week relaxing the telemedicine standards for out-of-state providers. So a lot of people that travel from Tennessee, Maryland, Wisconsin, Michigan to Florida, and they're here on vacation or they're here on their summer homes, telemedicine standards have been relaxed so that providers from other states can consult with their patients while they're in Florida. But as was just stated, that applies to providers outside of Florida having the ability to provide care for patients that are in state. Under our license, we don't have that same relaxed option. If your patient travels to Kansas and they're there and they call you for care for some reason, you're not licensed to practice acupuncture in Kansas, then your telemedicine privileges stop at the border of Florida.
Thank you, David. Will an electronic signature work for a waiver?
Yes.
Galina, if an existing client cannot sign a consent to treat telemedicine for treatment in telemedicine form right now, would consenting by email to telemedicine count as a legal consent?
At the current moment, during the coronavirus, yes.
Thank you. Next question. I can't pronounce this. Some lab just send an email saying that we can order 5 COVID-19 tests as a practitioner. With what was just said about referring out, is it best not to run this test if the government criteria are met? I think that's an ethical question, not a telemedicine question. So you have to, I'm gonna answer this and anyone jump in. You're gonna have to use, your personal ethics and morals and make that decision for yourself. Are you using the word telehealth and telemedicine interchangeably?
Yes,
Yes. And you can also use virtual, correct?
correct.
How do we bill insurance companies for telemedicine? Which codes do we use? That is a webinar that is going to come up. We're working on that. We were hoping to get someone on tonight that would help answer these questions, but this was all last minute. So we are working on it. We are in contact. We'll have that for you soon.
In my class, I do give those CPT codes and actually how to deal with them. A little bit more specifically, it needs to be seen.
Okay, so they can do your telemedicine
Yeah,
webinar.
and they will get an answer. Yep.
Okay, there you go. Are you sure that Unified Practice just rolled out telemedicine? No, I'm not sure. It was something I saw. Whatever EHR platform you use, contact them directly, check your emails. A lot of them are emailing out. I don't use Unified Practice, and they're not currently a FSOMA member, so I don't have that information readily available. And if I am incorrect, I'm sorry if I misspoke. Malpractice company, I don't know what, that's just a statement. You have to be more specific. Can we legally communicate to patients that we can assist through telemedicine to help with treating flu symptoms, including for COVID-19, and even help to provide the primary care to get patients to go to the hospital?
I wouldn't be so blunt in the statements. I would say that, again, follow CDC guidelines and ask standard questions. Have they been in trouble? Have they been in contact with anyone who was infected with COVID-19? Make a statement that you really don't treat COVID-19, but you can treat cough and fever. And if they suspect that they could be exposed to COVID-19, they need to contact their primary care physician and get guidelines from them.
Thank you. Is there a template or sample telemedicine consent form? Do you have something like that, Galina?
Yes, in my class, yeah, absolutely.
There you go. Take the class, everyone. And it, by the way, the class is very affordable. So
yeah, right now it's actually even special for all of us in times of hardship. It's only $79. So
that's a steal.
And you will get 4 PDAs for NCCOM in safety category, and it is for CEUs, which FSOMA will post for you on CE Broker as well.
I've been sending out a link to the regular class pricing, so I'll post the link to the discounted class later.
Yeah, I literally just moved it, and it's now in special tab right on the top called Telemedicine Corona Special.
Thank you.
That's
That's
a reduced price. I don't know how much is that usually?
Usual 99, reduced 79.
Thank you, Galina.
Thank
You're
you.
welcome.
All right. So before we continue, Jennifer wants to make a statement.
Well, no, I'm going to need to hop off here, but I just wanted to say one thing quickly. And I know that we're all wanting to help in every way that we can. I know that herbal medicine is really coming into view in a way that it really hasn't before. And I just want to remind us all that, you know, the wisdom of our medicine and is really based on pattern discrimination. And that's really what allows us to get the most effectiveness from our treatments. And so it's delightful, and it's so nice that we're getting so much information shared with us on different recommendations for formulas. But I really urge you all to do is everything that you can with the diagnostic tools that you have, whether it's questioning, whether it is, you know, seeing a tongue over the phone. We really do need to make sure that the herbal medicine that we're offering is specific to that patient, to that presentation, and is not formulaic. We're not a formulaic medicine. And so I'm so glad that we're here at this moment and that we can help, but I don't want to forget the beauty and the basis of our medicine. So thank you all so much. I'm sorry I have to hop off.
Thank you, Jen.
Absolutely. I support Jennifer in all attempts. The biggest beauty of traditional Chinese medicine, which allows us to avoid numerous side effects, is treating the pattern. Pattern is more important than disease.
Yes.
Thank you. All right, so we've been at this for an hour and a half. We still have 20 questions on the queue, so I'm going to try and run through it as quickly as possible. I ask you guys to take in consideration our time and not do any more questions. We can probably see if we can schedule another one if there's any more, you know, if there's a need for more questions.
I just want to ask Natalie, before we move on, I just want to say something because some of us might jump off. I'm staying the distance, but I want to reiterate that FSOMA is not a regulator, and we're not here to provide regulating advice to the profession. We're here to discuss best practices and how to apply, you know, both an ethical and standards that follow guidance from the CDC and the Department of Health. So some of the questions that we got are really strictly, in my mind, in the regulatory realm. And so we have to wait for some guidance from regulators on those questions. And in the meantime, use our best practices, knowledge, skills, and abilities in a way to safely and ethically treat patients. And I just wanted to make that statement because I sympathize and understand and empathize with the questions that were being asked. And I hate not being able to be really definitive in some of these responses. But it's just that line in the sand where our role is not to regulate. We're here to help with best practices. So all of the guidance that you hear from us falls into that realm, okay? And we'll continue to provide updates as we learn more information that gets us more and more definitive answers to your questions. Thanks, everybody. Let Natalia move on with the questions.
Okay. There's a question on clarification for Governor DeSantis' executive order. Please note that FSOMA did send out an email to our members about this today. If you are currently not a member, I'm going to tell you to please become a member and support our efforts to move forward in our profession.
I did send a version of it out to non-members as well. But.
Okay. Currently, do we know which insurance companies plan on covering telehealth consults when performed by an AP? I don't have a list of that. I don't know if any of you do. Like I mentioned earlier, we are working with one of our insurance billing members, and we will have that for you as soon as possible. Another billing code, what codes? Galina said that you can take her telemedicine course for a list of some, and then we'll have more on that soon. Is there a FSOMA endorsed sample note chart or platforms? No. Currently, we do not have that. If I have clients who went home out of state, can I see my clients if I'm not licensed in my home state? No, you have to see clients within your home state that reside in your home state. Can Acupuncture Board of Florida upload, I guess, new information in board website simply? I don't know about the Acupuncture Board. I think they have a meeting for Friday. And I believe we're encouraging everyone. Go ahead, Ellen.
Yeah, the Friday morning, I believe it starts at 9. If you go to floridasacupuncture.gov and click on meetings, you can see the FAR notice, which gives you the phone number and the time and the agenda. And it is a telephone meeting. I'll put the link on.
Perfect, thank you. We already answered that one. No, you see patients within state. How long will the ban last? No idea. Well, I think we're all moving day by day. I don't believe there is any legal term for Florida, whether you want to use telemedicine or telehealth or virtual consultations. The three are being used interchangeably. Is there a list of reciprocal states that allow us in Florida to work with clients via telemedicine in other states? I had read that some states allow and others might not. I'm not billing insurance and only provide nutritional counseling. I believe this question was already answered, and the answer is no under Florida license.
So usually, let me clarify that. As long as you hold an acupuncture or Oriental medicine or East Asian medicine, whichever way you want to name it, in any state in the United States, you become legally responsible for your advices. Accordingly, you have to practice in compliance with your license. If you are a licensed provider, so far you can practice telemedicine only in the states that you hold a license. The only relaxed requirement, which so far, to the best of my knowledge, has been signed by federal government is up of HIPAA compliance law temporarily, allowing the use of FaceTime and Skype technologies for patient communication. To the best of my knowledge, but it changes every minute, the proposal to eliminate state lines have been submitted to the Trump administration, but has not been signed. The moment I have any updates or any Florida State Oriental Medicine Associations members have any updates, we definitely will deliver them to you.
Thank you. Galina, you said that you are in Ohio. Do you see your telemedicine patients in person for the first time, or can you take new patients now?
Unfortunately, by Ohio law, acupuncture law, actually Oriental medicine practitioner law, it's very clearly written that we have to see initial visit in person. So at the current moment in the state of Ohio, I do not take any new patients for my virtual visits, and I'm not practicing any acupuncture, not at my private practice, nor at the Cleveland Clinic as of right now. So I accept new patient for telemedicine only in Florida right now, because I am a Florida licensed provider, and Florida law allows me to establish initial relationships with the patient via telemedicine.
Thank you. I have a patient that lives in Tennessee. He's supposed to come and see me. Due to coronavirus, he is not allowed to travel. Can I see him over telemedicine even if he lives in another state? His wife wants to be my patient. No.
If you're not licensed in Tennessee, you cannot see him. Refer to local provider.
Face-to-face NP in California. I cannot find this anywhere in our regulations. It's face-to-face needed in California. Do you happen to know about California?
In general, it is a standard definition of billable practices. The appointment becomes billable for any medical provider when you see patient face to face. Be it in-person visit or be it telemedicine visit, it's still face to face, to physically see patient. The only time you can use phone consult is temporarily during coronavirus with established patient if any other means of face-to-face technology like HIPAA compliant sites or temporarily FaceTime and Skype have failed.
Thank you. I have another question. My question would be, what constitutes a billable diagnosis for telehealth? Does it have to be an upper respiratory diagnosis?
Absolutely not necessarily. It's always will depend on individual insurance policy of the patient. Unfortunately, it's the same like with acupuncture. Some insurance policies will pay for evaluation codes to acupuncturists and some will not. Changes by the minute. Call to each individual patient insurance.
Next question. For VA patients that we are not allowed to prescribe any herbal medicine, what telemedicine can we offer them?
That is something for you to discuss with your administration, and sometimes it may vary location by location, hospital by hospital. Unfortunately, I'm not the biggest specialist on VA, so you might refer to hospital administration. They will be your best resource.
I think quickly on that question is now on the authorizations for care from TriWest, and they may say maybe true for Optum, is they provide a list of acceptable CPT codes included with your authorization for care. Some of them they include E&M codes and they include procedural codes. You might review what's authorized under the authorization for care that's specified for that patient and carefully refer to those codes and see if it includes things like nutritional consultation or any other specific CPT code that's allowable under that authorization for care. You might check with the nursing team or the nurse coordinators to make sure that telemedicine is approved for VA patients, but if it is approved, then I imagine the CPT codes that are authorized for you are approved as well. They'll only pay for one E&M encounter for the patient per period of authorization. So there's a possibility there. If you're working with a patient that's referred to you for pain, that has a history of PTSD or other comorbidities, you may be able to, under normal circumstances, you could submit those codes as part of your care. But you might just check with the nursing coordinators who authorize that, the individual consults and authorizations for care.
Thank you.
One remark which I know about VA, that so far only VA doctors are exempt from state line law. They can practice across in the entire United States.
Okay, where do we sign up for telehealth class? I believe the website is asiantherapies.org. Can FSOMA and the Board of Acupuncture link up for a webinar? Okay, I will add that to my list. And we'll see. we'll see what we can do. Thank you for your request. Hold on, give me 1 second. In regards to existing patients, can you speak via telephone, or do you have to still see them face to face with a phone camera? I believe we've definitely talked about that a couple of times. I am asking if we can do NP on telemedicine. Question was not clear.
I don't know what NP means.
Yeah, I don't know what NP means either. Do you have any idea of when we will be having that? No, you guys, I would ask you, we are on Instagram, we are on Facebook, we're on LinkedIn, we're on Twitter. Sign up for as a member, and we will send you all that information once we have it set up. We're working really hard for you guys and doing the best we can, but we're all also, keep in mind, we're shifting as you're shifting as well. We're all in this together. We're definitely not being affected by this. We are personally also being affected by this. So we're dealing with our personal lives, we're dealing with our private practices, and we're here to support you in the association and our profession as well. So give us some time for that. You can also email us, and we try and respond as quickly as possible. Okay, NP means new patient. All right, are chiropractors still seeing patients? We're not the Chiropractic Association or the Chiropractic Board. Regarding,
I want to make a comment about that. I've made it in the chat as well. Their website has the same language posted as what we've posted on ours, which clearly states healthcare providers have to limit themselves to emergency, urgent treatments. And yet they say on the same website, it doesn't apply to us. So my take is they're saying they're not healthcare providers. But basically they have a different lawyer that's had a different interpretation. They have not asked the governor for the governor's take on this. We did. We got a clear message from the governor that he meant, you know, only emergency and urgent care could be provided. So they're under their lawyer, they're dealing with it their way. But we got a clear message from the governor that all healthcare providers, which I would think would include them, are under this law. So that's all we'll say on that.
Right. I'd say that they stipulate other healthcare practitioners' offices to be closed and are not providing these non-emergent services. And the definition for healthcare practitioners in Florida is very easy to find. Chapter 456, 1, Section 4. And it includes acupuncturists, medical doctors, osteopaths, chiropractors, physical therapists, every conceivable healthcare practitioner, chiropractors are listed among them. So I think the statement from the governor is clear. The interpretations are just different.
In regards of telehealth law, actually, even your athletic trainer is subject of telehealth regulation.
You mean medical pulse. Sorry, Charles, I'm not sure. Probably when we were talking about the pulse for that, Galina has created an amazing way to translate electronic pulse reading with just with 2 little fingers. And you can see that on the website. Okay, so we're last 3 questions. If considering seeing patients, is it also helpful to remember to ask yourself if you can provide an appropriate disinfectant, safe distance environment for every patient in your clinic? And can you do this with the supply you currently have at your disposal without depleting supply that may be needed for the emergency response professionals and truly ill patients? Thank you for your statement. What support is FSOMA offering acupuncturists who have had to shut their clinics due to the virus?
Use telemedicine. Your front door is locked, but you're not shut out from providing care.
Thank you, David. I heard the governor's proclamation from FSOMA. I assume most practitioners who are not members have not heard. Will there be an announcement to acupuncturists who are not connected with FSOMA from the state telling them of the restrictions? As Ellen mentioned earlier, if you are signed up for our email list, we have sent out also an email for those that are currently non-members. So yes. And we also have the Facebook page where we're always posting things as well. So anything that we do send out, we always send out to everyone. Our aim is to be inclusive. We are one professional organization. We're all here in this together. We want to be supportive of you, regardless of whether you are a FSOMA member or not. Obviously, if you are, it would be really, really helpful for the advancement of what FSOMA can do for our profession, especially during these times. But that's just my 2 cents. So we're done with questions.
Can I say one more thing? I was going to say, I think we have support for practitioners that are anxious about their income interruption as well on the website for resources for unemployment options given your employment status. There's different options for people that are employed, for people that are contractors, people that are self-employed, as well as options through the Small Business Association where they've relaxed and extended additional lines of credit for small businesses that expect to be impacted by the coronavirus. There are some requirements for the size and nature of businesses to qualify for that, but I think FSOMA has those links and resources either available on the website or is part of an e-blast. So certainly there's a lot of anxiety about interrupted income, and I think everybody should be sort of looking closely at what might be available through temporary stopgaps for employment, funding that's available through unemployment, as well as lost income and loans.
Thank you, David.
Yes, it is very, very hard times, and I'm looking at that website. Since we reviewed the website, there is about 200 new cases of coronavirus in United States, and another death has occurred. So we are now 3rd country in the world in number of corona cases. We had the most amount of new cases. Please stay safe. Please keep your patients as safe as possible. And sometimes loss of income is better than loss of life.
Thank you. And thank you all of you for joining and sticking with us these 2 hours of information. Your questions were great. I know that there was a couple questions that we couldn't get answers to or didn't have time. That's because we wanted to focus on this one topic today. Please know that we are working really hard every day to make sure that we bring you the best resources for you to be successful and to be safe. So I wish you all and your families the best in health through all of this. And we're here to support you the best we can. Thank you, everyone.
Thank you, everyone, and sorry, refer you to my website. The class was written specifically just because I get so many emails with the questions, and some of the things just need to be seen. It's why the class has been written and has been posted, just to make sure that I still can have my life while I'm helping all of you. And I apologize that it's not always free, just because the approval of the classes for continuing education units does cost. So please stay safe, keep your patients safe. Thank you, Florida State Medical Association, Ellen, Natalia, David, thank you so much for your great work.
All right.
Thank you, everyone. Have a good night.
Okay.
Bye-bye.
Good night, thank you.